Hi everybody, thank you for clicking on this video. Today we're going to be talking about cochlear implants. While hearing aids are the most commonly referred solution for people with hearing loss, sometimes there are those who might be better served by cochlear implants. These are medical devices that work a little bit differently than hearing aids. Hear Center isn't an expert on this topic, and we don't do any sort of consultations for cochlear implants at our clinic. So what we've decided to do for this presentation is just to scour the internet for some helpful, credible sources, distill their main points, and put them all into a presentation here for you. So we hope you find it helpful. So taking it right to basics, audiologists are those who will assess your hearing. These are clinical experts who prevent, diagnose, and treat hearing imbalance disorders of all ages. So this ranges from really young, infants, newborns, all the way up to seniors. After you undergo a hearing test and an assessment, the audiologist will describe your hearing. So you might have normal hearing, or you might have a mild to moderately severe, or profound hearing loss. It really depends. And hearing loss is such a broad condition. You might be born with it, it might be acquired, it might suddenly come on, or it might slowly worsen and develop over time. With a hearing loss, it's difficult to hear. You might struggle hearing conversations or people's voices or their speech. So you might find that phone conversations are quite difficult to have. Maybe you don't struggle with face-to-face conversations, but struggle hearing in noisy environments. Maybe you wouldn't want to work in a noisy cafe or try to have a conversation in a loud restaurant. With a profound or complete hearing loss, you might struggle to hear anything at all. Speech, ambient noise, music, it's all just inaccessible for you. For most non-medically treatable hearing loss, the common solution is to wear hearing aids. It can be in one or both ears, and there's many different styles to suit many different lifestyles, hearing goals, and lifestyles. However, with those who have severe to profound hearing loss, where hearing aids might not provide any benefit, a cochlear implant is an option. To put it briefly, the difference between a cochlear implant and a hearing aid is that there are some components of a cochlear implant that are surgically inserted, and with a hearing aid, the whole structure and components are removable. We divided this presentation into 3 sections. What are cochlear implants? Who are candidates for cochlear implants? And what you can expect after cochlear implantation. Hearing aids work like a microphone and amplifier. They take incoming sound, amplify it, and send it back into your ear. On the other hand, cochlear implants directly stimulate your auditory nerve by sending electrical signals. It bypasses the damaged or missing parts of our hearing system. To understand this more and how cochlear implants work, we should have a brief understanding of how we hear. So on the right here, you will see a simplified image of our ear. You have 3 components: the outer ear, the middle ear, which is this canal space you can see here, and then the inner ear. You can look at that as the purple snail-looking object that is your cochlea. And then you have all these nerves and fibers that go towards our brains. So let's think of a bird. So when a bird chirps and we hear the sound, that sound travels through the air in vibration. So we have molecules vibrating through the air, and eventually it reaches our ears. So when these vibrations hit this purple-looking snail, it displaces fluid. The fluid moves little hair cells that we have in the snail And this displacement of fluid sends signals or electrical signals that travel up through some nerves into our brain. And then in our brain, we register them as sound, and we can say, oh, we hear a bird. That is the sound of a bird chirping. Someone who has impaired or damaged structures in the inner ear might not be able to receive signals that represent sound. So structures that create electrical impulses are missing or damaged, resulting in us being unable to hear. Cochlear implants, they replace those structures that are responsible for sending signals. And they're composed of two components. There is an external and internal component. The external component is composed of a microphone, speech processor, and transmitter. And in the internal component, which is surgically inserted, contains the receiver and then deeply implanted electrodes in the inner ear. The two components are coupled together using a strong magnet. And in this simplified image from Science Friday, we can see both components as well as a zoomed up view of the inner ear. In this image, the purple snail is now a blue snail. So the microphone and all the external components, they pick up the sound and the speech, and then in the receiver, those signals are transformed into electrical pulses. Those electrical pulses are traveled along these electrodes, which, as you can see, are directly inserted into the inner ear cochlea. Here, those electrodes stimulate the auditory nerve, which tells the brain we are hearing sound. According to the FDA, the first cochlear implants were approved in the mid-1980s, and since 2000, they have been FDA approved for use with children beginning at 12 months of age. In December 2019, approximately 736,000 registered cochlear implants have been found worldwide. But it's important to understand that cochlear implants don't restore hearing. And in fact, hearing through a cochlear implant is a little bit different than normal hearing. If you'd like to hear a demo of what cochlear implants and hearing aids sound like and the difference between the two, I highly recommend checking out the Science Friday article, which I will list in the description bar below. So with any sort of surgical procedure involving an implanted medical device, there are some risks. According to the FDA, this includes injury to the facial nerve, infection, numbness. However, there are also many amazing benefits of cochlear implants. With cochlear implants, training, and rehabilitation, those with hearing loss may be able to enjoy music again. They may be able to participate in speech, hear different listeners, make phone calls. Anyone of any age with the right resources and training can benefit from cochlear implants. So just who are candidates for cochlear implants? In addition to the primary care physician of the individual, the cochlear implant team might involve an audiologist who can perform hearing tests and examine the outer, middle, and inner ear, the surgeon, of course, a speech-language pathologist, and a psychologist to assess whether or not the candidate can cope with using an implant. According to healthyhearing.com, kids who have profound hearing loss in both ears, have little to no benefit with hearing aids, are healthy with no compromising medical conditions, understand the role and success of cochlear implants, have educational support from a program that helps develop and strengthen auditory skills, are good candidates for cochlear implants. For adults with severe or profound loss, who have little to no benefit with hearing aids, have no medical problems to put them at risk during surgery, and have a strong desire to participate in the hearing world are also great components for, are great candidates for cochlear implants. Active cooperation from the patient, as well as having a strong support network, whether you're a child or whether it's a child or an adult, are two components that are critical for success with cochlear implants. And yes, older adults who are in their 60s, even up to 100 years old, are candidates for cochlear implants. I have a professor in my graduate program right now who told me that she fitted a 99-year-old with a cochlear implant, which is incredible. So, are you able to hear right after cochlear implant surgery? Well, not quite. So, immediately after surgery, which includes the internal receiver and electrode array, the external component, which has that microphone and the processor, that won't be given until about a month after the implant surgery. So post-operation, it's expected that the individual takes about 1 month to allow the area to heal before adding the external components and before any programming begins. After the 4 to 6 weeks of healing, you're going to have your initial programming session, followed by several follow-up appointments. After the external component is added and then the cochlear implant is activated, most people don't understand that the information that the implant is providing them. And the goal here is to get the nerves and brain used to hearing again. Over the following months, the patterns and stimulations provided by the implant will be understood by the brain. And every 6 to 12 months, as the hearing becomes more sensitive, then you'll just have routine programming appointments to fine-tune the programming. And programming is actually just the first step to successfully using and integrating a cochlear implant into someone's life. There is a lot of retraining of the brain to understand the stimulations and sounds that are provided by the cochlear implant. Sounds may be heard but not understood, and so auditory rehab is a necessary and vital process for cochlear implant wearers to effectively integrate into their lifestyle. Oral rehab connects the puzzle pieces of sound and meaning together. The benefits of using comprehensive auditory rehab have proven to be significant. They can reduce one's perception of hearing difficulties, improves the perception of quality of life, and help someone become a more effective user of their cochlear implant and communication strategies. Counseling, auditory training, communication strategies, and speech and language treatment may all be some components that someone might go through with auditory or oral rehab. And it's important to understand that oral rehab takes time. So the earlier children receive an implant and undergo the auditory rehab process, there's a higher chance of language acquisition. With adults, it's found that they have better outcomes with their cochlear implants if they have active cooperation and commitment to an auditory training program. Okay. And that takes us to the end of our presentation. It was very short, but all the links that we use to provide research for this presentation will be listed below in case you want to read more about it. And we have a new and improved website for 2021. If you haven't visited it yet, go to www.hearcenter.org to see our new site with tons of information about our clinic and our services. If you have any questions or feedback for me, you can definitely email me here at my email address or visit our hearcenter.org website to find more contact information. We hope you have a wonderful day. Thank you.